The Fascial Distortion Model, F.D.M, is a very specific concept. A few preliminary considerations may be helpful to achieve a better understanding of the innovation offered by the F.D.M. There are 6 types of fascial distortion. Herniated Triggerpoints, HTPs, is one of them. Herniated Triggerpoints, HTPs, are a specific type of fascial distortion discovered by Dr. Stephen Typaldos as part of the Fascial Distortion Model, F.D.M. These distortions are characterized by the abnormal protrusion of tissue through the fascial plane. The fascial plane acts like a smooth, flexible sheath that allows muscles and other tissues to move without friction. When this tissue protrudes through the plane, it results in pain and discomfort. Why do herniated trigger point occur? Herniated trigger point are often linked to weaknesses in the fascial matrix, particularly where neurovascular bundles, nerves, and blood vessels pass through the fascia. These passage points are inherently weaker and more susceptible to herniation or tissue protrusion. While herniated trigger point can form anywhere in the body, they are most commonly found in regions subjected to repetitive motion or pressure. Common symptoms of herniated trigger points. Localized pain. The pain is often pinpointed to a specific area. Pinching or catching sensations. Patients may feel a pinching or catching feeling in the affected area. Reduced range of motion, ROM. HTPs can restrict joint and muscle movement, making it difficult to perform everyday activities. Patient indicators. When diagnosing HTPs, a patient's body language and self-reported symptoms are key indicators. Unlike other conditions, patients with HTPs often have a strong instinctive understanding of where the pain is coming from. Body language. Patients will frequently press directly on the painful area using multiple fingers, a thumb, or a knuckle. This gesture is an intuitive attempt to reduce the protruding tissue back beneath the fascial plane. They may even ask others to apply pressure to these spots for relief. Verbal descriptions. Patients often describe the sensation as a dull ache, tightness, or localized pain. It's common for them to express relief when pressure is applied to the painful area, but once the pressure is released, the pain returns. Worsening with movement. Movements, especially those involving the affected muscle or joint, may exacerbate the pain. However, direct pressure on the HTP provides temporary relief, further confirming its presence. Treatment of herniated trigger points, HTPs. The treatment of HTPs is relatively straightforward, but requires precise manual manipulation by the practitioner. The aim is to reduce the herniated tissue back below the fascial plane. This is often achieved through the use of the thumb technique. Thumb technique. The practitioner applies pressure using the tip of their thumb to the exact spot where the patient feels the most tenderness. The pressure is applied gradually, increasing as the tissue begins to reduce. The thumb is gently thrust through the fascial plane, pressing the protruding tissue back into place. Complete reduction. It is essential that the practitioner reduces the entire herniated tissue. If any part of the tissue remains herniated, it can lead to sharp or pinching pain, which may worsen the patient's symptoms. This is why patient feedback during treatment is crucial. Fascial plane closure. Once the tissue is reduced, the tension in the fascial matrix helps to close the hole through which the tissue herniated. This process typically takes about 90 minutes to complete. During this time, adequate hydration is important, as it facilitates the closure of the fascial opening and helps prevent recurrence of the HTP. Key points in HTP treatment. There are several important factors to keep in mind during HTP treatment. 1. Gradual increase of pressure. The practitioner should always start with a gradual increase in pressure to avoid causing the patient excessive pain. This also helps to gently coax the tissue back into place without causing further trauma. 2. Proper angle of force. The angle at which pressure is applied is critical. The practitioner needs to apply pressure in the direction that corresponds with the patient's pain, as this often aligns with the direction of the herniated tissue. 3. Hydration. Adequate hydration is crucial for the timely closure of the fascial plane and preventing the recurrence of HTPs. Dehydrated fascia is less pliable and more prone to further distortions. Subtypes of herniated trigger points. HTPs can be categorized into 2 subtypes. 1. Non-banded HTPs. Non-banded HTPs occur when a small opening in the fascial matrix allows tissue to herniate through. The herniated tissue often has a larger diameter than the opening through which it passed, making spontaneous reduction difficult. 2. Banded HTPs. Banded HTPs are associated with trigger bands, another form of fascial distortion. In these cases, the banded tissue prevents the herniated tissue from being easily reduced. Treating the associated trigger band is often necessary before fully resolving the HTP. Fascial rent. In some cases, the herniation of tissue occurs through a fascial rent, which is a larger linear opening in the fascial plane. When this happens, a longer portion of tissue protrudes through the fascial matrix. The treatment for a fascial rent is similar to that of HTPs, but the entire length of the protruding tissue must be reduced. Once the herniated tissue is reduced, it is important for the practitioner to palpate for any remaining firm edges of the fascial opening. These edges should also be tucked below the fascial plane to ensure complete closure and prevent recurrence. Conclusion. Herniated trigger points are a common yet often misunderstood source of musculoskeletal pain. If left untreated, they can persist and lead to long-term discomfort and restricted movement. However, with proper identification and manual reduction techniques, such as the thumb technique, practitioners can provide significant relief to their patients. Key takeaways. Identifying HTPs relies heavily on patient feedback and observation of body language. Treatment involves carefully reducing the herniated tissue back below the fascial plane. Adequate hydration and full reduction of the tissue are essential for long-term relief. Addressing trigger bands may be necessary for treating certain types of HTPs,